This presentation is about right hemisphere syndrome. Everyone has two hemispheres in their brain. They're called the left hemisphere and the right hemisphere, and each of these hemispheres specializes in different skills. Today, we're going to talk about the right hemisphere. The right hemisphere is important for communication and cognition. The responsibilities of the right hemisphere are to regulate cognitive functions such as attention, orientation, and problem solving, for perception, to process the emotional and non linguistic elements of communication, such as facial expression, gestures, and body language, for the prosody of speech, which is the rate, pitch, and stress of speech, for math skills, and to process music. Right hemisphere syndrome is the result of damage to the right cerebral hemisphere, and this can cause problems in communication and/or cognition. What causes right hemisphere syndrome? Strokes, tumors, trauma to the right hemisphere, degenerative disorders, seizures, infection, and toxicity. Right hemisphere syndrome signs and symptoms. There are two major areas of deficits. The first is in cognition, and the second is in communication. Right hemisphere syndrome signs and symptoms. This slide's going to talk about problems in cognition. So, patients can have issues with attention for sustained and selective attention, in perception of depth, distance, and shapes, orientation. They may not know the time of day or year, and these patients may live in a world where time does not change. Neglect, when a patient only pays attention to one side of his or her body and environment. With right hemisphere syndrome, this is typically the left side of the body. Impaired construction ability, due to the difficulties in attention, perception, and neglect. They have difficulties drawing, copying designs, creating designs with blocks, and reproducing 3D constructions with blocks. Anosognosia, which is denial of having a deficit. Prosopagnosia, which is the inability to recognize faces, even their own face. And confabulations, fabricated experiences or situations to fill in their memory, but are not done intentionally. In the second area, for problems of communication, these would include language, with word meanings, also known as semantics, and the social components and uses of language, which is also known as pragmatics. And speech, where the rhythm, stress, intonation, rate, melody, pitch, volume, and pauses between words and sentences. This is also called prosody. Diagnosis of right hemisphere syndrome. Speech-language pathologists are the professionals that diagnose right hemisphere syndrome. They do this by establishing background information, giving a neurologic evaluation, performing informal and formal tests to assess the patient's areas of strengths and needs. The amount of deficit the patient has will depend on the severity and nature of the brain damage. Once the SLP has diagnosed the patient, they will create a personalized treatment plan integrating the patient and his or her family members and significant others' beliefs and values, along with their clinical experience and what the research says is successful. Here are some strategies you can use when communicating with someone who has right hemisphere syndrome. Ask the patient questions and remind the patient to stay on topic. Create a daily routine. Break down large tasks into small, manageable pieces. Talk slowly to allow the patient to process what you have said and use short, easy to process sentences. Write down information. Remind the patient to look at his or her left side of the body and environment because they may be neglecting that side. Be empathetic, not sympathetic, and have patience. This will be a very frustrating process for yourself and the patient, and you just need to have patience and work through your challenges. Foster success whenever possible. It's important to celebrate your small successes. This will keep yourself and the patient motivated. And do not allow the patient to become isolated. This can be extremely damaging to the patient and will not help them become a better communicator. Some resources to look at are the American Stroke Association and the National Stroke Association. These two websites will give you a lot more information that may help you understand right hemisphere syndrome a little bit more.